Today we have with us Abhinav Lal, co-founder of Practo, Dr. Parameshwara CM, MBBS, MS, Professor of Surgery, and Professor of Surgery, Surgical Gastroenterologist, Chief Colorectal Surgeon, and Sarang Sharma, Head of Product at Practo. If you have any questions during the course of the webinar, please feel free to put it in the chat box and we will respond to them towards the end. Starting off this webinar, we have Dr. CM Parameshwara Gowda, who is one of the promising colorectal surgeons in Bangalore. He has completed his MBBS from Bangalore Medical College and further done his MS from Rajiv Gandhi University of Health Sciences. He is the founder of Smiles Hospital of Coloproctology, Bangalore since 2013, and Inventure Ashoka Shala, which is an affordable rural school, and also of the Varu Mother and Childcare for the lower strata. He is an active member of Indian Medical Association, International Society of Coloproctology, Colon and Rectal Surgeons of India, and European Society of Colon and Rectal Surgeons. Dr. Parameshwara has also completed his MBA in Healthcare and Hospital Management from Karnataka State Open University and an advanced management program in healthcare from Indian School of Business, Hyderabad. His mission is to make colorectal care affordable and accessible to all, and to continue providing quality education for rural India while making sure all patients he treats are pain-free.
Thank you so much for the introduction. Thank you very much. And it is a Shivratri day, and I wish a happy Shivratri to all in the meeting.
Happy Shivratri to you too, Doctor.
Thank you. I am sitting in a temple and I'm in the meeting. I have come to a temple which is about 900 years old in Mandya.
That's great. I mean, auspicious day indeed.
Auspicious day, and it was 900 years back the algorithms were started. 900 years back, the algorithms, what we are going to talk now. It was 900 years back, and this temple is 900 years old.
Right. So yes, yeah. Dr. Parameshwara, over to you then.
Yeah. Yes, Abhinav, good morning.
Good morning, Doctor. Happy Shivratri, and thank you for taking time on a holiday to spend time with us and with our doctor community to talk about ABDM.
Yes. So I was told to start from slide 2 and slide 7.
Okay, so can we move to the next? Yes, Doc. We are on slide 2 right now.
We are on slide 2. So the slide 2 says era of digital healthcare. Okay. It says digital innovation is changing healthcare as a patient seek on-demand healthcare and improving quality of care. Okay. So the whole issue is see, what I can tell is we are right now on a digital highway. This is one of the ambitious projects of Government of India, and Prime Minister Modi ji has taken special care, task to this, and with an ambitious mission of reaching healthcare to the to the poor, to make healthcare accessible, to make healthcare safe, to make healthcare easier for the patients, for the providers. So this mission has started with that big mission. Okay. Now, what I feel is Practo as an organization started this in 2008. Imagine in 2008, Government of India had started along with Practo. Today, where we would have traveled the journey in healthcare. So, better late than never. We are on the right track. We are on the digital express highway now. Now, as a practitioner, as a clinician, as a healthcare facility provider, what I would like to tell my doctors is very, very, very simple. Not many doctors in this country are tech savvy, or they resist technology. They resist computers. They resist using any kind of apps. This is what my observation is. Today, one message I will tell the doctor: whatever amount of digital healthcare comes in, whatever amount of digital mission comes in, nobody can replace a doctor. But in other places, Amazon, you can buy online. You go to a street vendor, he has got a scanner. You can buy pani puri by scanning your mobile. In healthcare, you may give the money online transfer. You may do an online consultation, but there is a limitation in healthcare for telemedicine or digital health. How? I will share a story with you which happened in telemedicine. One of the persons who was 46-year-old, he went with a simple bleed for an online consult. On an online consult, the doctor who prescribed for the bleed assumed that it is piles, and he was given treatment online prescription. This patient, after 4 months, landed up with me. Sir, I had an online consultation and this was medicine prescribed. I said, come, let's examine you. I took a detailed history. When I put my finger inside, I could see a cancer in the rectum. So this is the story of a patient who went online consultation. So very clearly, as a doctor, I would say it is physical plus digital. Phygital. Combination of physical plus digital can deliver better healthcare to the patients. Number two, now it is era of digitization everywhere. You take in any field. I will start with an example. You have e-banking now. If you have account in one branch, you can access the bank anywhere in the world. Same is this digital health mission. You have a health facility, you register with ABDM. You're a practitioner, you register with ABDM. There is a patient, patient has got ABDM number. So basically, the country, the digital mission is trying to integrate all so that it will be easy to deliver healthcare in a safe way, in a better way, which gives better clinical outcomes and better results to the patient. For example, one more story I would share. Why digitization is important? Why ABDM is important? What is the importance of ABDM? A patient goes to a hospital and he will get all the investigations there. The doctor would see, patient would spend about easily 25, 30K on the investigations. The patient now has to take a second opinion from a different doctor. He goes to a different doctor and that doctor would say, all these reports, I would repeat once again. Imagine a lab facility like Lal Path Labs, who is already a member in ABDM, will upload all his records in the ABDM app. When he visits the next doctor, the doctor will access all the reports and it will be easy for him to give a second opinion rather than repeating all the way the investigations. So this is a cost to the patient. This is a painful procedure for the patient. So this will come down. For example, I would share one more story here. Since I'm a gastroenterologist, a patient came to me with bleeding in the anal canal. When I took a detailed history, the patient had appendicectomy about 15 years back. Actually, that patient had Crohn's disease. Appendicectomy was done. Histopathology was not done. Imagine 15 years back, there was a digital app. In that particular app, if all his records were there, I would have seen that records and told, boss, your disease was Crohn's disease, not appendicitis. They have wrongly diagnosed and done appendectomy because of the pain in that particular region. So basically what I'm trying to tell here by digitization is the interoperability at every stakeholder, at the healthcare provider, the laboratory facility, the pharma facility, the stakeholders much bigger than them, people who are policy makers at the government of India level, maybe a government organization, maybe a private organization. Now, the moment you give data to this ABDM, Ayushman Bharat Digital Mission, you have enough data there of all the patients of the country. And now this AI data driven, the machine will tell, look, this is the kind of diabetic load in the country. Right now, we don't have proper diabetic load of the country. India is diabetic capital of the world. Imagine you give all the data to this mission. This mission tell, look, these are the number of hypertensives in this country. So what exactly I'm trying to tell is doctors should not resist in sharing their data, patients' data on one single platform where the machine will process everything and give an output so that it becomes easier for the policymakers, the healthcare providers, the pharma guys, the diagnostics guys to plan healthcare for this country. Because you know very well, today we are in inflation. 100+ countries are bankrupt. Still, India is going stronger and stronger. I know there will be some amount of inflation in India as well, but not to the extent of other countries where few $1 trillion economy will be wiped out. So at this stage, I will tell one statement today that it may be any aspect of healthcare. It may be agriculture. It may be infrastructure. It may be power. It may be health. It may be education. One statement, you digitize or you die. If you don't digitize, I'm sure death is waiting at the doorstep. Abhinav, you can add to this now.
Thank you so much, Doctor, for sharing your perspective. It was very, very helpful. And also for sharing stories which kind of explains the value of the whole Ayushman Bharat Digital Mission approach.
Yes.
What we can add. So I hope that all the doctors on this call have actually found immense value in the stories that you have shared and examples that you have shared on how practical it is and how it's going to add so much value for the provider and at the end allow them to provide better care for the consumers, for the patients, which I think is going to be the biggest win with this digitization.
Yes, the biggest win, as you said, Abhinav, was number one is combining digital plus physical will have a great clinical outcomes. Number two, it will have a great patient experience. Number three, the human interactions in healthcare. See, when a patient enters a hospital, there is a front office, there is a registration, there is a doctor, there is a nurse, there is a counselor, there is a janitor, there is a housekeeping staff. So the interactions, human interactions will be removed out. It will be minimized by digitizing healthcare. Why human interactions is, for example, if I tell a story again, I would speak one thing to the doctor, to the patient is not satisfied. He goes to the ward. In the ward, the patient will talk to the staff nurse. She speaks a different language. I speak a different language. The patient is confused. So the errors can be minimized by digitization very, very clearly, because whatever I have said to the patient, it is there in a digital record in the nursing station. She would see that and communicate to the patient. Am I right, Abhinav?
Yes, doctor. Definitely.
The errors can be minimized. The errors can be minimized.
Yes, definitely. The errors
One
can
more
be
story
minimized.
I want to share, which happened just last week.
Yeah.
Very senior surgeon from a great institute in this country. In my own center, I will confess, I'll not hide my mistakes. In my own center, patient had pelvic floor descent, rectal collapse, cystocele, and a fistula. This surgeon had given up fistula and did the other work and came out. Patient was about to discharge. Patient said, one last time I would see you. She came to me. I examined. The fistula was not done. So why this error? Because there is no digitization in my hospital. We are not completely digitized in my hospital.
Yeah.
So the doctor sitting here, I am telling you, the healthcare providers, we need not reinvent the wheel again. The wheel is already invented. The biggest wheel in the country for digital healthcare is none other than Practo. Practo has everything, whatever ABDM needs. Am I right, Abhinav?
That is correct, doctor. That is correct.
Am I right?
Yes, doctor. That is absolutely correct.
Practo has got every. Actually, right now, today in this country, the only organization who can take on a full-fledged basis integration of ABDM is Practo, none other than Practo. I've done research on all the aggregators in this country. I've done research on all the laboratories in this country. But what I found out was what Practo has got, it is easy to integrate with ABDM. That's it. Anything else, Abhinav?
No, thank you so much, doctor, for sharing all this. Now I will walk everybody through a little more technical details of how ABDM works and how the community can actually benefit from it.
Please.
Thank you so much, doctor, for taking time.
Yeah.
Right. So I think doctor already covered a little bit about Ayushman Bharat Digital Mission. But before I get into Ayushman Bharat Digital Mission, I wanted to talk a little bit about what is the value and how does it really work. And a good way to understand ABDM is also to look at another industry which has actually already gone through this digital transformation over the last 7 to 8 years, which is financial services, payments, fintech, what we call today. And in that, we have seen that's kind of the biggest change that has happened in the country, and not just for us, anywhere globally. Today, India is the largest digital payments, real-time digital payment in both in number of transactions. We are way ahead of any other country. And all of this happened because of the building blocks that the government actually put. So if you think about 20 years back, 30 years back, 40 years back, the role of government was to create infrastructure, right? The government built the roads, the ports, the airports, and that actually enabled the industries to grow. In today's digital world, the Indian government has taken a similar approach of creating digital infrastructure. The roadways, the roads on which we can actually create digital economies. So starting with that, the financial services was where the first thing happened. And there were three different pieces that actually created the foundation. The first was identity. In any digital infrastructure, one of the more expensive things which every company has to do and everybody has to do is actually making sure the people who are participating are the people who they say they are. And in that sense, we had two things that actually got created, which was mostly Aadhaar, and then the KYC, which was required for financial services, actually reduced dramatically, right? Not every company has to reinvent the wheel. The second thing that happened, that the data that existed within the financial system, even though most of the banks were already digital when UPI came into existence, the data was sitting there in different formats. It was not interoperable. You couldn't really combine data. And a lot of transactions where it's still, even though there was digital, it was still, majority of the journey was still physical, right? You will go withdraw the money from ATM. And now when you spend that money, there is no tracking of where that money was spent. And that data cannot be used to provide additional values that I'm going to talk about later in my slides. And then the last thing, which was transactions, right? On top of that, today, I, as an individual, may be using PhonePe app and my bank account is in SBI, and another individual could be using Google Pay and their bank account is in HDFC. They can still transfer money to each other seamlessly at almost no cost. So that's kind of the payment foundation. And the similar thing is being created in healthcare now. So if we go to the next slide, the base is identity, which is the ABHA number, ABHA number for the patients, a health professional ID, which is for doctors, health facility IDs, which is for clinics, hospitals, labs, pharmacies, so that it's important. So in our case, again, the data was becoming digital. It's already been becoming digital, but it's not very easily accessible, right? So if I go to a lab today, and most of the lab today will actually give me a report in a PDF format, but that data kind of sits in my email, in my WhatsApp, I change my phone, that data is lost. So it's not getting, the whole history of patient is not getting created. And the report format is not standardized. So even though I have gotten my blood sugar done over the years, today I can't see the trend over what's happened. So we wanted to kind of solve for these two specific problems. And that's when, if we go to the next slide, patient, right? These are the different types of health records. So the idea is to start with minimal information. The idea is not to change the workflow that most doctors are following today and put additional burden. The data that is being created digitally already, how do we share it with patients, right? So today, diagnostic report, discharge summary, consultation notes, prescription and immunization record. These are the types of health records which are part of the first iteration of ABDM, which is already live today. So how does it actually work in real world? For patient to participate in the ecosystem, they need to create a ABHA number and then a ABHA address. The ABHA number is associated with, it's a verified patient. So you can verify yourself using your Aadhaar or your driving license. And like I said, the government is actually creating the highway. So the government has created the infrastructure. You can go to the government website and create your ABHA number of address, but you can also go to any of these applications. Practo, Paytm, Bajaj Health, Arogya Setu, any of these applications, and a patient can actually create their ABHA address. Or for people who don't have a smartphone, they can actually do it in an assisted mode using biometric authentication. So every ABHA number and ABHA address that is being created is a verified patient that exists in the ecosystem. And when such infrastructure is created, we are able to actually solve some unique use cases. So this is an example of a use case which did not existed when ABDM was envisioned, right? But after we went live and the different use cases were found, we actually discovered new things which can be solved. So if we go to the next slide, you will see how ABDM is actually making patient registration easy, fast, and accurate. So QR code, which almost everybody in the country is now familiar with because of payments. A similar infrastructure is being created as part of ABDM, where a patient, when they walk into a clinic or a hospital, they can register by just scanning a QR code. So if we go to the next slide, this is how it works. You register with a platform which provides ABDM compliant software. Practo is one such software. So if you register with Practo, you actually get a QR code that you can put in your clinic and hospital. The patient walks in, they scan the QR code. They can be using any of these applications, right? Including Practo's consumer application. They get an option to share all their profile data, their phone number, their ABHA address, their ABHA address, age, gender, date of birth, all these information, and more information is being added here. They just click one button, they are automatically added to the software, a token number is generated. And by doing this, for a larger hospital and setup where people were waiting in queues for 15 minutes, are now actually able to finish their registration in 5 minutes. If we go to the next slide, Keshav. This has already been implemented in some of the large government hospitals. So AIIMS, in Bangalore, a couple of large hospitals are actually using this, and patients are able to actually do the registration. All information, like Dr. Parmeshwar talked about, all the information is digitally shared, no errors, all the information automatically and authenticated. And when this is done, if a health record is generated in the system, it's automatically shared with the patient. So how does sharing of health record actually works? So for any health facility, for you to participate in health record sharing, you need to actually register health facility. You need to create your health facility ID. Keshav, if you can go to the next slide. Any of these health facilities, imagine it's a clinic or a hospital or a diagnostic lab, should be using a ABDM compliant software. And when the health record is actually generated, a notification is sent to this ABDM DPGs, which is the common infrastructure. And then the record is fetched and linked to that patient's Aadhaar address. And the patient has the option to choose to save this health record in a locker. And then patient has also the opportunity to share this health record by providing consent. So the health record can only be shared by doing this. Now, all of this is happening where the health record is being shared with the patient, is directly being shared with the patient. The actual data is not going through the government infrastructure, which is part of the federated architecture, which I'm going to talk about in a couple of slides. So if we go to the next slide, this happens if patient actually provided their Aadhaar address at the time of registration. But even in case the patient forgot to share their Aadhaar address, they haven't created their Aadhaar address at the type of registration, when they actually go to the health facility, they can come back, they can download a PHR app. And again, there are multiple PHR apps that exist in the ecosystem already, including Practo. The patient can actually find their health record that is with any facility and get access to them. So Keshav, if you go to the slide, the next slide, which is an important one. So this is how it actually works. How it actually works is there is no central repository. So most of the countries in the world, when they actually create a solution like this, there is generally a central place, a central database, a central system where all health record, every provider is supposed to upload. One of the great thing in ABDM architecture, the way the government has actually implemented it, is that the health record sits in the doctor's, clinic's, hospital software itself. It is never actually leaves that place and shared with a central government system. The only thing that is happening in this process when a health record is shared is the patient's address is being linked to that health record. So as you see in the example here for a patient Sandeep321 at the rate of ABDM, which is their Aadhaar address, just like you have your UPI ID, the central system only stores that this patient has a OPD record at Diagnostic Center X on this date, right? This patient has an IPD record at Hospital Y on this date. The actual health data is actually not shared with the central system. When the patient needs to access this data, they can download this data in real time, or they can download this data and keep it with them. So it has been created and for easy sharing of data. It is created to be privacy protecting. And more importantly, all this architecture is created in a way where it is compliant to the upcoming personal data protection law. So any clinic and hospital which is actually using this ABDM compliant software automatically becomes compliant with the upcoming personal data protection law of the country. So that's another benefit that you get by actually adopting this. So like I talked about, we have the identity, which is health facility ID, health professional ID, and Aadhaar number. And then I talked about there is a second layer, which is the data, which is health record being shared digitally with the patient. The third pillar of this whole architecture and the approach is UHI. What is UHI? UHI, a good way to kind of understand, is taking the principles of UPI in some way and applying that to healthcare, right? So if you have ever felt that the patients are reaching out to you for follow-up on your personal WhatsApp at odd times, you wanted a better way to manage it. Do you want to charge for providing online consultation services or online longer follow-ups, or you want to provide patients ability to book appointment with you online? All of this actually gets solved with UHI. Today, in such use cases are being solved by individual companies. And for every company that you want to tie up with, you need to download their software, you need to set up your profile there, configure everything, and use multiple applications. UHI actually removes all of that hassle. So if we go to the next slide, effectively what happens with UHI is that you register your health professional ID. You could be using any ABDM UHI certified software. And again, Practo Ray is one of the software, even though UHI is not launched yet. We are part of the small pilot that is already running in UHI. So in Practo Ray software, you can configure whether you want to do, are you available for online consultation? Are you available for physical consultation? How much is your consultation fee? How much is, do you want to provide online consultation through chat, video, audio, all that configuration. And if you have this setup already in Practo, great. If you don't, you can very easily set this up. Once you do this, any consumer facing application, which allows patient to search for doctor and book appointment or do teleconsultation, you show up on all of those platforms. So just by using Practo Ray, once you set up your profile, you set up your configuration on your availability and everything, whether the patient is using Practo UHI section, whether the patient is using Arogya Setu, whether the patient is using Paytm, they will be able to find you on all of those platforms. So UHI actually decouples this, just like in UPI, patient, the merchant, the shopkeeper and the consumer can be using completely two different platforms. Here also the patient and doctor can be using two completely different platforms, and you are available on all those platforms, which actually allows patient to discover you. So that's UHI. So that's at a very high level, what are the different building blocks of ABDM, how it works. Identity, data sharing, and transaction. These are the three things which allows ABDM to work. Why should you participate in ABDM? The first thing is, of course, the most important thing of this whole architecture is, and the whole goal of the ABDM from the government end is that allowing you, the doctors, to actually provide better care. Everybody knows this. It's just that it has been very difficult to practice. If every doctor by default have access to all of patients' medical history, every health incident that happened, every medication they have taken, every allergy, every report, every scan, and the software that doctors are using can become smart to summarize this and provide a summary of all of this health information, will allow every doctor in the country to provide much better care to their patients. The second thing is also, so to kickstart this whole process, the second thing that is happening is the government is also providing incentives. The idea is that for the ABDM to work, the doctor community, the clinics, hospital, labs needs to adopt software. The government is actually subsidizing the cost of these software. So if you take a parallel again to UPI, in UPI today is the only place where there is no merchant fees. If you go to a shop today and if you use your debit card and credit card and the merchant is using a machine to swipe that card, they end up paying 1%, 2% of that fee to the network which is running, which is MasterCard, Visa, and the company which is running the POS machine. But in UPI today, the government has actually made the MDR, which is the merchant discount rate, 0. So when you actually make a payment to the merchant using UPI, the merchant actually gets 100% of that money. And the reason why it is enabled is government is actually providing the incentive. So the same is happening in ABDM. The government is actually paying incentive for health records to be shared. But the underlying idea is that as a doctor, if you're using a software product and there is a cost associated with it of adopting and utilizing the software product, the government is actually giving you enough incentive to cover that cost. Yes, if we can go to the next slide. So this has already been announced. I will share a little more of what it is in the next slide. So you can see for hospitals and diagnostic labs, this is already live. We believe the similar setup will be launched for clinics soon. So effectively for a hospital, for every transaction above the base level, for every health record, digital health record shared with the patient, and linked with their Aadhaar address, the government is paying 20 rupees. So if a hospital is actually seeing 1,000 patients in a month, and the base level transaction is 500, that means for 500 transactions they actually get paid. There is a potential to earn as much as 10,000 rupees a month, which not just cover the cost of the software, but also cost of training, implementation, and adopting this technology. And last and not the least, one of the things that we keep hearing from a lot of doctors, I have personally met hundreds of doctors over the last couple of months talking about ABDM, is this sense that ABDM is something that is going to happen over the next few years. But here are some of the data points which kind of establishes why it is important to adopt this today. Keshav, if we go to the next slide, ABDM actually reached an important milestone in December last year, which is 30 crore patients in India have already created their Aadhaar ID, right? That's almost 25% of country's population has already adopted and created their Aadhaar address. What is even more exciting, where we are seeing the adoption, we talked about digital record sharing, health record sharing. On 16th January, the whole ABDM platform reached a very important milestone of 10 crore health record linked digital. A majority of them are, of course, public hospitals and public program yet. But what is very interesting is that from the 10 crore health record shared on 16th of January, the platform actually reached 20 crore. So another 10 crore health record got shared from 16th of January to 6th of February. So 20 days it took, right? If I look at the public hospital and adoption of ABDM 1 year back, this number used to be, in 20 days, most probably 10,000, 20,000 records were shared, right? A few thousand records being shared a year back. That is the number at which the private clinics and hospitals are today. And within a year, in public setup, that number has actually grown by, I can't even calculate the math, 2,000 times, right? And we really believe that even in the private segment, there is a probability that we will see similar adoption over the next year or so. And this is a great opportunity for providers to actually start adopting this today rather than waiting, because this is a good time to get started and be the early adopter, tech-savvy doctors who are actually adopting this technology and providing better outcome. Government is providing incentives so that the cost of adopting this technology is subsidized. And of course, the patients are actually using this more and more every day. So how do you get started with this? And how do you participate if you run a clinic and a hospital or a lab today? You can actually participate by using any of the ABDM certified software. Of course, Practo's software are ABDM certified, and Sarang is going to cover a little bit more detail in the later slides. You do this either by going to the ABDM website and registering your facility, or you can onboard directly on Practo Ray, which should be live with this feature in the next week or so. So yeah, that's all about ABDM, right? You can ask your software vendor to get you started on ABDM. The government has already created the highway, like I said, the infrastructure, digital infrastructure. The roads are open, and it is now the healthcare fraternity who needs to actually come and adopt this. These numbers are slightly older, from a few weeks back. As you can see, we had already reached 27 crore Aadhaar number a few weeks back, and 1 lakh health professional. So 1 lakh doctors have already created their health professional ID, and 1,73,000 clinics, hospital, labs have already created their health facility ID. So some distance to go. So with that, I will pass it on to Sarang to actually talk a little bit about Practo Ray and how Practo Ray can help you adopt ABDM.
Hi, good morning, everyone. Very happy to see such great participation on Sunday morning, and thanks a lot to both Dr. Parmeshwar and Abhinav for the great insights. So I'll talk a little bit about Practo Ray, which is the Practo software product. A lot of doctors have already been using it. I think a lot of you might already know Practo was launched. Practo Ray was a flagship product of Practo, launched back in 2008, along with the starting of the company by both Shashank and Abhinav way back in 2008, right? And it was also launched and created with this exact same vision, which is being achieved now through the government, which is one, of course, making it very easy for doctors to run their practice digitally, but also to be able to share records digitally with patients, right? And that is something which Practo has been doing for now a few years, but it's now very exciting to see the government taking a lead here and ensuring that this whole process becomes interoperable, right? And so it's not just Practo software, but all softwares that doctors use across the country and all apps that patients use across the country, right? Get this feature and they can all talk to each other, right? And yes, of course, so the software has been around for 14 years, and we'll speak a little bit about the features. It's currently being used by about 20,000 clinics across the country, and we have about overall we have number of digital health records created and shared, right? Has exceeded 2 crores, right? 21 million in 2022 alone, and 193 million so far, right? That's about 20 crore, almost 20 crores. Right? Again, these numbers might be slightly old. So almost 20 crore patients have used the Practo ecosystem so far. Just going ahead, I think how will Ray enable assist doctors and clinics? Of course, as Abhinav said, you can today go and register yourself and your facility, health facility, clinic, hospital, etc. on the ABDM website, or you can do it directly via Practo. Now, I mean, it's one of the same thing. The advantages people or doctors who already have profiles on Practo, if they create via Practo, it will be a little easier because all of the data is already entered. But if you do not have it on Practo, you can first create on ABDM and then come and log in to Practo and import your data, right? Having done that, having linked your practice details on Practo, what you will be able to do is you will be able to create this QR code that Abhinav was talking about. You will be able to display this QR code in your clinic, in your hospital. Patients who already have ABHA numbers, ABHA addresses, using one of the many apps that are ABDM compliant, will be able to come and digitally register with your practice. They don't need to fill a paper form, stand in a queue. You don't need to employ multiple staff to cater to heavy OPD traffic. This can all be done digitally, seamlessly. On top of that, you can also help patients who don't already have an ABHA ID, right? Help create that ABHA ID through Ray. You can just enter the patient's phone number, a message will go to the patient. He or she can fill the form digitally and then register, and automatically that registration also happens in your clinic, in your software, in the Ray software you're using. Once this is done, once patients have registered with your clinic, they do the consultation as usual. Doctors in your clinic, in your hospital can write a digital prescription using Ray. And once they've written the digital prescription, it automatically gets shared with the patient through the ABHA ecosystem, through the ABDM ecosystem. The record stays in your software. It is you who control the record, right? But it is accessible by the patient. Tomorrow, the patient wants to share it with any other clinic, any other doctor, any other facility. They can do it using the ABDM ecosystem. And then, of course, not just you sharing records. Patient comes to your clinic, your hospital in the future. You want to request their past history from, let's say, a diagnostic lab or from another hospital, another clinic. You can do it with just 1 or 2 clicks using the ABHA number, ABHA address the patient has given already in your Ray software. You will be able to fetch all the records that are available with the patient. Of course, with the consent of the patient, patient will receive a consent request, which you will be able to initiate using Ray. They will receive it in their app, just like using Google Pay, etc. Today, people can send payment requests to other people. You will be able to send a request or consent request to patients to share the health records. Once they have shared it, you will be able to access all the health records they have shared inside Ray, right? Just very good snapshot. I think we spoke about some of these things. Once you have created your health facility inside Ray, you will be able to get a QR code, which is a ABDM QR code, right? And you will be able to display it. This QR code will be available inside Ray. You can print it from there. You can use it digitally, either ways you want. And patients who walk into your clinic will be able to scan that and instantly register with your clinic. No more need to fill a form, or your staff doesn't need to ask them about their mobile number, email, address, age, gender, DOB, all those things, and while holding up other patients, right? So patient just walks in, scans the QR code, and automatically gets registered. They get a token number. Once their turn comes, they just go and do consultation with the doctor, right? In case they don't want to do it by QR code, maybe their phone is not working right now, internet is not working, they can just give you their Aadhaar address. You can enter the Aadhaar address inside Ray, and in one, just enter the Aadhaar address, an OTP gets sent to the patient to verify that this is indeed their Aadhaar address. They'll tell you the OTP inside Ray, and then all of their information, such as their name, phone number, age, date of birth, etc., gets captured immediately, right? So all of these details come into your clinic, they get registered instantly instead of asking all of these details one by one, right? Once the ABA address is registered in Ray software, then you can, any prescriptions you create, any treatment plans you create inside Ray get automatically shared with the patient through the ABDM ecosystem. And of course, the other features inside Ray is easy calendar management and scheduling can also be done. UHI, which Abhinav also spoke about for a bit, right? You will be able to get your UHI appointments also in the same calendar where you're managing your offline patients or your other Practo patients, right? So you get one unified view of all the patients for today, for tomorrow. You can plan your schedule accordingly, right? And then, of course, we spoke about you can create digital prescriptions inside ABDM. They get shared with the patient. You can create consent requests, right, for that patient. Again, through the ABDM digital ecosystem, they get a request on their phone. They're able to accept that request or give consent. And then all of the places where the health records are stored, right? Imagine the health records are stored in 4 or 5 different, diagnostic laboratories, which are all using different softwares. The records are also in 3 or 4 different hospitals, which are all also using different softwares. But since all of them are ABDM compliant, all of them speak the same language with each other, and they're able to collate their records and share with them. And then you can see a longitudinal timeline of all their records, right? So you can see, okay, what were their test reports looking like 6 months back, 1 year back, 2 years back, and you can actually see their history, right? You can see their medical condition unfolding in front of you over time, and hence give a much better diagnosis. Yep, that's pretty much it. I think all the features of Ray, of course, other features of creating prescriptions, billing, etc., are all available as well. But now I think with the ABDM ecosystem and with ABHA coming in, with UHI coming in, I think the power of Ray and the power of any clinic management software is going to multiply several folds. Yep, that's it from our side. Kishal, you want to open the floor for any questions, etc.?
Thank you. Thanks, Sarang, Abhinav, and Dr. Parameshwar. We do have a couple of questions. I think you all can take it accordingly. So first question we have is, how will ABDM help dentistry? Okay, Dr. Parameshwar.
Yes. Yeah, okay, so I can take this up.
Sure.
So specifically, the ABDM ecosystem is broadly designed to help almost every specialization in a very similar way. So even in case of dentistry, some of the values remain the same. Of course, the first and foremost being having access to patients' longitudinal health data. Specifically in case of dentistry, actually having access to patients' old x-rays, their old treatment that has happened, wherever they have gotten done, having access to that will actually make the quality of service and the quality of care and the outcome that doctors can provide to the patient, it should improve significantly. Of course, the other thing that Sarang talked about, faster registration in clinic, not having to have additional manpower, being able to do online transactions, being able to be discovered by patient, all of that adds. Dr. Parmeshwar, you have something to add?
I'm audible? Yeah. Can I
Yes,
add here?
doctor. Yeah,
Yeah.
please go ahead.
Dentistry is also a separate specialty on its own. They also have a super specialty. They have pedodontia, they have orthodontics, orofacial-maxillary surgeries. There are many different subspecialties and super specialties in dentistry. So every dental patient has got a data. Got it? They have X-rays, as you said. They have some, surgeries getting on the face. There are some trauma cases on the face. I mean, trauma accidents where the face is repaired. So dentistry is not just simple with the 32 numbers what we have. It's much bigger game than that. I'm sure ABDM will help the dentist, because if I take a dental treatment in Bangalore and then go to Delhi and I don't carry any records of me, and I see on my WhatsApp or anywhere it is deleted, your data is there in your ABDM app, which is secure, which is private and protected. So anywhere in the world, any patient can access dentist, because today the crowd is mobile. Today, majority of the crowd today, they're in Bangalore, tomorrow they're in Gurgaon, tomorrow they're in Noida, tomorrow they're in Mumbai. So while traveling is becoming more, shifting jobs, changing places, definitely dentistry will have a great help from ABDM, Abhinav.
Yeah. Thank you, doctor.
The next question we have is that how can doctors be part of the ABDM ecosystem? I know, Abhinav, you have briefly answered this, but maybe you want to talk about it in context to Ray. Maybe Sarang, do you want to take that up?
Yes, sure. So I think one of the ways Abhinav already mentioned, right? So you can go to abdm.gov.in, right? And there you can, there's a link for called HPR or health providers, right? You can go there and you can fill up their form. I think there are a few details that they will ask. Of course, there's some Aadhaar-based authentication that you also need to do, right? To really prove that it is really this doctor who's signing up, right? As Abhinav said, that the identity layer is the most important, right? So that there is no impersonation that happens. You go there, you prove that it's really you who's logging in, and then you fill some of the details, similar to how you create your Practo profile on any other website, right? Where you give your name, you give your details of your specialization, which college you went to, what degree you did, right? Which year you completed your degree, etc., etc. Right? So those things you fill up, and then I think there's a 1 or 2 or 3 days maximum verification process where someone in the National Health Authority verifies your details, and once it's done, then you get that HPR card, right? So you get a health provider ID, HPR ID. Similarly, for your clinic, there is a HFR section on that same website, a health facility registry. You can go there and create your health facility registry. You can also create it via Ray directly, right? So if you have Ray software, you can go there. I think that release is going to happen by about next week. Post that, you can go and actually you can log in using your HPR ID and your password, and you can create your health facility registry. Or you can do it directly on the ABDM website also, and then directly come to Ray and enter the HFR ID, right? So those are some of the ways of becoming part of the ABDM network.
Thanks, Sarah. The next one we have is on the incentive program. What will government pay to the software companies, and what will government pay if already the patient has ABA and visits the hospital?
Yeah, so in this case, actually, what government pays for specifically for hospitals is 20 rupees for every health record that is shared and linked to a ABA address. So even if the patient has an existing ABA address, if a health record, a prescription, a OP consult, or a lab report that is shared with the patient, the government is right now paying 20 rupees. And the software vendor, which is actually providing this software to that clinic, to that hospital, is actually paid 5 rupees. So that's at a very high level. There are some conditions on eligibility. So it's not like that everybody gets the thing. There is a eligibility criteria that is there. There is actually a calculator that is available on the ABDM website. I am actually pasting the link in the chat for that. So you can go to this link and then there you can actually enter the details. And this actually tells you what is the incentive that is possible to be earned in a very easy way.
Thanks, Abhinav. The next one we have is that are dietitians, Ayush doctors, physiotherapists allowed to be ABDM? A similar question also from the homeopathy side. Are they? Is it applicable to them? Yeah,
that's a great question. Dietitian is something that I also am not aware of. So this is something that we'll have to check and come back. But for Ayush, specifically Ayurveda, homeopathy, actually it is possible to register today. The Indian government has been very supportive of our own medicine system, and the ABDM program actually supports it completely. So if you today, when you go to actually register for a health professional IT, and let's assume you are from Maharashtra, as long as you are registered with Maharashtra Council of Homeopathy, or any similar state council in each state, or a council for Ayush and Unani, which exists in most of the states. If you're registered with any of those, you should be able to create your health professional ID. There are no restrictions.
Yeah, I would like to add here, Abhinav. ABDM mission is focusing more on wellness than illness. So there is the Government of India's big initiative is wellness promotion, and they have wellness clinics across the nation now. So they are also allowed to register.
Thank you, Dr. Abdul.
Yeah.
I think Dr. Manish is also asking specifically about dietitian and physiotherapists.
Yeah, we will share this detail, doctor, with you offline. Let me also validate this. I don't want to, I think it is, but I will need to validate it once, and I will come back. The team will reach out to you and let you know, and we will maybe talk about it a little more in our upcoming blog post.
Abhinav, I would add here, physiotherapist comes as a package with the orthopedic surgeon. Okay. So whenever they work with an orthopedic surgeon or a neurosurgeon or a neurologist, so physiotherapist has also got an important role to play there. Okay.
Yes.
So according to me, as a bundle of services, they are allowed to register with ABDM. Okay. That's number one. Number two is dietitian. Dietitian also comes with endocrinology, gastroenterology, and other metabolic disorders. Okay.
Yeah.
So along with those people, even their data, a dietitian's data is also, will go to the, the ABA registration of the patient. So in my opinion, so they are also allowed to register. Example, a specialty hospital which has got an endocrine department and a dietitian. You can't separate them, right?
Yeah.
So they come as a package. So I'm sure they will also be involved in this mission, Abhinav.
Yeah, yeah.
One more question we have is that, can the Aadhaar number map to the ecosystem?
So that's a good question. So Aadhaar number is not directly mapped to the ecosystem, but Aadhaar is actually utilized as a way to prove, is one of the ways to prove the identity. So when, for example, when a patient is actually creating a ABA number, today, one of the ways they can actually verify themselves is through authenticating through Aadhaar. Of course, the other way is also supported, that is today's driving license. So Aadhaar is being utilized in this ecosystem as a way to verify the identity of participants, but they are not directly being linked to this. And this is being created as a separate identity system specifically for healthcare.
Thanks, Abhinav. Just want to check, is there anyone else who has any other questions, or you would like to unmute and ask your question yourself?
Hello.
Yes, Dr. Agarwal.
Yes. Good afternoon. It has been a very good discussion, and the platform was very good. The basics of getting connected and how to create a good data and to record the data has been done very well. Already I'm in the field of homeopathy. I had put my question. To get more details, because I'm practicing in Maharashtra, I've been registered with the Maharashtra Council of Homeopathy. If I can get Abhinav Lal's mail ID so that we can have more detailed discussion about it and about Practo Ray, how to get the platform of Practo Ray. These are two things I would like to understand so that we can get registered with them as well as know more better to create our own health professional ID.
Sure, doctor. So I will get the details from team and I will reach out to you separately. On getting Practo Ray, I think the team has already put this in the chat, but I will call this out again here. For everybody who participated in our webinar, thank you so much. And what we are doing is, even Practo Ray is something that we built 14 years back. So that was our starting point of the company, and that's how me and Shashank actually started. We wrote the first piece of software together. With ABDM now, since we have government incentive that is also being provided to the software providers to enable this, and we also have some partnership with pharma companies who are also willing to sponsor some of the software that we are distributing. We are actually providing Practo Ray for free for 1 year exclusively to all the attendees. So the team will has shared a link. You can go to that link and fill the form. We will also send a WhatsApp message to all the participants or email all the participants with the link to fill the form. And over the next week or so, our team will reach out to you and help set up the account. You can use, we are providing the full Practo Ray product without any feature restrictions. So you get access to all the features of Practo Ray. The only limitation being it's limited to 250 appointments being managed every month in the product. Yeah. So I hope that Dr. Agarwal has actually answered your question. So the team will send you the more details offline on how to sign up and start using the product Practo Ray for free.
Thank you.
We have one more question as well. I think, Sarah, maybe you can take it up. Those who are already using Ray, will they be registered by default with ABDM?
So no, you will still need to register with ABDM, right? So again, as I said, there are two parts to it. One is the health provider registry, which is for the doctors, and then there is the health facility registry, which is for your clinic, right? So currently, for creating your HPR ID, which is the provider registry ID, you will need to go to the link I have actually added to the chat box. You'll need to go there and create that. And once you've created that, then you can log into Ray, and we will have a section there for registering your health facility registry ID, HFR ID. And you can do that via Ray. You can also do that directly on the ABDM website. Via Ray would be simpler in my opinion, because we have tried to keep it a little simpler. And once you have done, so once you create your HPR ID on the ABDM website, you can come to Ray. You can enter that and then create your health facility registry ID. And once you have done that, then you are fully set up. No more steps required.
Can I ask a question?
Sure, doctor. Please go ahead.
Good afternoon. I'm Dr. Raghavendra Karthik here from Chennai. I have a question to Abhinav and Sarang, will all this data be available for insurance companies if they want to get it access from your ecosystem?
Yeah, so great question, Doctor. So the whole ABDM architecture, the way it is built on consent. The consent architecture of ABDM is actually based on a general consent architecture that exists for the country, which was created by MIT around 3-4 years back. It's a common architecture. Every industry is adopting the same thing. So even in financial services, the same architecture is being created, where imagine a loan company wants to get access to your bank account data for them to process the loan. They can actually request it. But in that case, the consumer has to provide the consent. So even in this case, if an insurance company needs access to data, that can only happen by patient's consent.
Right.
Without that, the data cannot be shared automatically. So all the data flow that happens within ABDM ecosystem will always happen through consent. How it works is that there is a PHR app concept. Any company can build it. It is an open ecosystem. Multiple companies have already built it, including us. Patient could be using any of those. So when an insurance company requests data, let's say for Sarang, the Sarang's phone, there is a notification comes saying that insurance company XYZ wants your healthcare data from this date range, from this doctor, or for these, they want access to your prescription, they want access to your report. You can actually define it in a very minute way. If Sarang approves that request is when the data is actually shared. Now, when the data is being shared, according to the law of the country, it is only shared for a fixed time period. So when the request comes, the insurance company will get access to that data. Let's say for 30 days, they are asking for access to that data. After 30 days, they are required by law to delete that data. So the whole architecture is actually built around saying the data owners, which is providers and patients in this case, have full control over how the data flows and who have access to it, right? And the way, like we talked about earlier, the data always sits in the software that the doctor is using. It's not actually removed from there and kept in some central repository.
Okay. But does any anonymous data is being provided to insurance companies for any purpose? Not linked to a patient's name or ID. Just the health data alone, is it being provided without the patient's consent?
There is a provision in the thing where it can be. So far, I am not aware of any of it that is actually happening practically. But the only place there where I know that the anonymous data usage is being discussed right now is mostly public health programs. Private insurance companies, a government-run insurance program where aggregated data is being shared with directly is not something that I am aware of, Dr. Yet. But there is a provision through which individual companies can get into agreement of actually sharing the data. There is since there is no central place or where all this data is sitting, the only way to get access to this data is getting consent from everybody individually. So little more complicated the way it is designed. It actually makes it a little more difficult. For anybody saying, give me all the data, they can't, because we have to go to individual companies, because the doctors will be using data from 10 different software from 10 different companies. That means the data is actually sitting with systems of 10 different companies. So there is no way for them and anyone to say, give me all the data. They have to go to those 10 companies and say, okay, I want access to data, I want access to data, I want access to data. But there is a provision of creating value from anonymized data, both for insurance and for public health use cases.
Okay. One final question, Abhinav. Well, you said the consent is required from the parties. The patient, for example, you can decide whether the particular data can be shared with the company. Is it a normal practice for a consumer like a patient to expect an incentive if the data is going to be shared to somebody?
We are hoping that this will become an economy by itself. Right? It hasn't happened yet. even in fintech, which is, I would say, 5 years ahead of financial services, which is maybe 5-7 years ahead of healthcare in digital adoption. Incentives for consumers hasn't happened yet, but that is always the aspiration. When we talk to the team at NPCI and couple of people from the government who have been played a very important role in shaping the architecture of the whole thing, there is always this aspiration that there is going to be a data economy that we will be able to create as a country, which is very unique and different from anywhere else in the world. That as an individual, all right, if my data is being utilized even at an anonymous level for creating IP, for creating newer products, or creating newer solutions which are actually profit-making entities, there should be a way for individuals to be compensated. But right now, it's still a theory. We haven't seen this happen in practice yet.
Thank you so much.
Do we have any other questions? Okay. I don't think we have any other questions for now. So then I think we can close this webinar. Thank you everyone for joining in, and thank you for all the speakers. As Abhinav also mentioned, that we have for this group that has joined this webinar today, you can click on the link shared in the chat box and fill in your details, and we will reach out to you. You can get a free demo of Ray and take it from there. We also have a special community for on ABDM with doctors. We have already about 150 doctors on that community, where we share updates on the new things, the developments that's happening within ABDM. We've also shared that link in the chat box, and you can join the WhatsApp group to stay updated and abreast on all that's happening in the ABDM ecosystem. Thank you everyone for joining, and have a great evening.
Thank you.
Thank you, everyone.